Hello, Lisa Broyles, MD, with Way to Health, MD. And boy, do I have a topic for you today. This is something that probably all of us have experienced at one time or another, but are too embarrassed to talk about it. And that's an itchy butt. So at one time or another, as a kid, as an adult, maybe both, we have all experienced an itchy butt. So what's causing it and what to do about it is the topic for today. So I live on a farm, and my children develop pinworms occasionally just from running around barefoot where we have farm animals. So the most common reason for itchy butt at my house is children with pinworms. Adults can get pinworms too. They're in animal poop, and we have goats, chickens, horses, you name it. So when children inevitably get some of the poop in their mouth from doing something and then eating or touching their face, humans tend to get an oral ingestion of the larvae of the parasites at that time. The most common one for farms are pinworms. I've seen hookworms as well. So what I do for that is in the middle of the night or at nighttime, you can do the tape test where you check your child's anus with a flashlight and look for little tiny, what looks like grains of rice that are right around the rectum, because the worms will lay their eggs right around the opening of the anus during the night, and this causes extreme intense itching during the middle of the night. You can also take a piece of clear tape and touch it to the rectum to see if you've got little white eggs or little white, looks like grains of rice on the tape. If so, then you've got your diagnosis, pinworms, and all you need to do is go to your local pharmacy, CVS, Walgreens, whatever's nearby, and get a bottle of Pyrantel Pamoate. Okay, this is a liquid. They've already got it flavored. The one near us has a banana flavor. So the dosing is on the bottle. Give your child one treatment, and then I recommend repeating it in a week so that any eggs that have hatched during the week will be killed by the second treatment. I do this once a year preventatively, typically for my children, or inevitably one of them comes to me with an itchy butt. The next most common reason for an itchy butt is yeast overgrowth. So that can be vaginal, or for men, just groin. Yeast can overgrow from hot, moist conditions, from eating too much sugar. You tend to get a rash that can be in the anal outer area, the perineum, and for women, they can have a vaginal discharge with it, but you can get yeast that's also on the outside around the anus. Treatment for this is eating a low sugar diet. Also, for women, I recommend using a probiotic that's in a tiny capsule. It's called Femdophilus, and they insert it vaginally nightly. And if this doesn't work, then I go to a prescription for diflucan, which is the generic fluconazole, 150 milligrams to 200 milligrams, depending on the patient, taken once and then often repeated in 3 days. For men with yeast, I go straight to the fluconazole, diflucan, one treatment repeated in 3 days. Avoid alcohol while you're on it. The third most common cause of an itchy butt is hemorrhoids. So if you struggle with constipation, or you strain to have a bowel movement, or you're a woman that's just had a baby, you tend to get hemorrhoids. Anything that increases intra-abdominal pressure can cause hemorrhoids. Hemorrhoids are rectal veins. They can be internal or external. The ones that hurt and itch are external, and the vein, the pressure from straining to have a bowel movement or weightlifting or having a baby, all of these things will push the blood and make that vein pop out. And it can be painful, like pooping through shards of glass, or it can be very, very itchy, especially when the hemorrhoids are healing. So what can you do about it if it's a hemorrhoid? How do you know? Hemorrhoids, generally you can feel an external hemorrhoid as a small bulge just outside of the anus or right on the anal opening. Sometimes it's actually obstructing the passage of stool a little bit. If it's soft, then it may resolve on its own. I recommend stool softeners, lots of fiber in your diet. Miralax is a safe powder. You can take a scoop of Miralax, stir it into food or water. It's tasteless crystals. Drink this. If that's not doing it, then Docusate, which is Colace 100 milligrams over the counter, can be added to the Miralax. You can also take magnesium at bedtime. The max dose of magnesium at one time is 800 milligrams. I recommend starting with 200 milligrams. And if you are prone to constipation, just go ahead and go for some magnesium citrate. You may need 400, 600, or even 800 milligrams to really make things move, but you have to keep your stools soft or the hemorrhoid will never heal. So with consistently keeping the stools soft and trying to avoid straining and heavy weightlifting, the hemorrhoids should heal. If they're really, really itchy, so bad that you can't sleep or it's really uncomfortable, then you can ask your doctor for a prescription for a topical steroid and apply just a pea-sized amount, a tiny bit, to the tip of your finger and put that on your rectum. And don't do that more than 1 to 2 times in about a 3 to 4 day stretch, because long-term use of these steroids will increase the risk of yeast overgrowth and thin the skin. But using it just here or there, 2 or 3, max 4 applications over 4 days, that's perfectly safe and will just help with the itching. It can also help the hemorrhoid to dry up a little bit. You can use sitz baths, you can use witch hazel wipes, and these also help dry up the vein. If the vein becomes extremely painful, then it could be thrombosed, and if you feel it and it feels like a little jelly bean and it's very tender, that means that the blood has clotted off and the blood can't get back up into the upper part of the vein, and that will have to be cut open and removed by a physician. So hopefully this has given you some insight into a condition that we all have had at one point or another. I'm happy to discuss it with you further, and thank you for your time.